Our foundation officially released a new strategic plan earlier this year. You may have read about it on our new website, but it's informed by the literature, which tells us that 80% of what influences a person's health and well-being happens outside of the healthcare system, like access to affordable housing, availability of good schools, limited exposure to violence, personal health habits, and personal and community support networks. This information is not new. For more than 2 decades, that awareness of what they call the social determinants of health and the impact that these determinants have on health and well-being has been well understood. Despite knowledge, the preponderance of our funding has nonetheless remained focused on health systems and system solutions. We know that domestic violence has its own determinants as well, like harmful norms and culture, weak social networks and trust, weak community sanctions against domestic violence, harmful media and marketing practices, housing security, and economic security are some of those factors which shape individual, family, and communities' experiences of domestic violence. This information, coupled with the needs and experiences of communities themselves, has led us to shift our strategic direction to ensure that our work is truly transforming and advancing health and well-being of all Californians, particularly our most vulnerable neighbors. We've set the bold goal of California being the healthiest state in the nation with the lowest rates of domestic violence. I want to highlight how important we think it is to leverage the power of community and the power of collaboration to achieve the change we're seeking. Our strategy expands our focus to look at the many factors that influence health and well-being and develop new approaches, collaborations, and solutions to achieving our goals. As part of our new strategic plan, we have identified our first 3 initiatives that will help us get at the root causes of good health, poor health, and domestic violence, and the interactions that we know take place among people, families, the systems that serve them, and the broader community. The 3 initiatives are breaking the cycle of domestic violence, collaborating for healthy communities, and designing the future of health. Weeks ago, on May 13th, we hosted a webinar to share elements of our new strategy. The webinar was recorded. A set of FAQs were developed. I encourage you to check that webinar out on our website. It can be found under What We're Learning. It goes into depth on the initiatives. The opportunity that we're speaking about today falls under our Designing the Future of Health initiative, but it's intended to support and impact the other 2 initiatives, breaking the cycle of violence and collaborating for healthy communities. We see this particular request for proposals as driving change across the initiative. Designing the Future of Health initiative, we are seeking to understand what the future will hold and how California can anticipate early and adapt to the changes that are coming, and embrace them as opportunities to produce health and violence and promote equity in our communities. This request for proposals, exploring the value of prevention, we are anticipating and wanting to get ahead of the important question of how we generate sustainable funding for prevention strategies that can create health, ensure well-being and safety by addressing the root causes of poor health and violence. What we don't want to do is test and implement a lot of great ideas, initiatives, and interventions, find if they work, and then ask the question of how we pay for them and sustain them in the long term. We want to ask that question from the very beginning of this plan and at the launch of these 3 initiatives, so they can generate early learning and thinking about the challenge of sustaining prevention strategies. This is the key question that we're trying to answer through this request for proposals. What would it take to generate sustainable investment in strategies that produce health and well-being and/or end violence? And I just want to clarify, because we've gotten some questions along these lines, that in submitting your ideas and your proposals, your approach does not need to address both health and well-being and violence. Policing health and ending domestic violence and violence are joint missions of our foundation. So we grouped those two issues together and interested in approaches that address the two areas. But for your proposals, you can choose to come at this from health or from violence, or could pose an idea that blends both those important issues together. The desired outcomes of this initiative, or this proposal funding opportunity, is to demonstrate the value of prevention investments and to grow the amount, sources, and consistency of funding dedicated to them. And we propose or posit that this could be achieved in different ways. One could be to use existing resources more creatively. One could be to develop innovations in the way that we finance prevention strategies, and another could be to engage new investors across the nonprofit, business, and government sector. There may be other ways to get at this question of demonstrating value, and we, in this proposal process, we're open to your ideas of additional approaches and definitions to get at this question. In developing the request for proposals, we talked to many leaders in the field and also drew upon what we have been seeing and learning from our own work, particularly in the initiatives we've been funding, like the California Accountable Communities for Health Initiative, or from the research that we've been doing to develop our new initiatives, both in breaking the cycle of violence and collaborating for healthy communities. From interviews and our own reflections and experiences, we identified the set of questions that's on this slide and is in the RFP document that we think are on the cutting edge of issues related to defining and measuring value in prevention and really getting at that question of how to generate sustainable will and funding. Proposals should seek to address one or more of these questions. And in the proposal, we ask that you clearly communicate which of the questions that you are intending to address or to answer through your proposed scope of work. And then, of course, to propose a strategy for how you're going to answer it. Alternatively, you could propose another important question, one that we've missed, that you think is on the cutting edge of what we need to do to demonstrate the value of prevention. There are three kind of general categories and questions underneath that we listed. The first one is, we're really interested in how do we define and measure value for complex approaches. So we know, based on what we understand to be the complexity of root causes of poor health and violence, that we need to match that complexity with an equally complex set of investments, interventions, and a set of outcomes that will drive us toward those goals. How do we measure value in ways that really honored and address that complexity? How do we go beyond dollars and cents to look at broader social benefits? So how do we not do a narrow kind of cost-benefit or cost-effectiveness analysis, but what are the other broader social benefits that might be accruing to individuals, families, or communities that we tend to not capture using traditional methods? The second area that we're very interested in, this comes is a strong issue that's coming up in our Collaborating for Healthy Communities work. We know that getting at the root causes requires steps to partner together in new ways to create an outcome related to health and well-being and ending violence. Those multi-sector partnerships have to bust through a lot of funding silos and structural silos to really surround the individual, family, and community and the issue that they're trying to work toward, the outcome they're trying to work toward. So here we want to ask the question of what are the ways that we could define and measure value in multi-sector strategies? Are there new financial structures or policies that would help us blend or blend resources across the sectors? So kind of new infrastructure that we might create that would make this easier, make kind of the right thing to do the easy thing to do. And finally, financial structures or policies that focus on communities demonstrating the greatest needs. So this is sort of how do we distribute resources? What are the structures for distributing resources that might really drive us toward more equitable outcomes and using the kind of multi-sector approach to do that? area, and we think this is a big sticky wicket in this space, is we know that when you invest in prevention strategies, there's a longer time horizon for outcomes, and therefore for investments to kind of bear fruit. And so we're curious, problems that are in front of us today, everyone sees them, everyone can feel when the change is happening, an immediate kind of return on investment. We want to know, how do you generate the belief or will to invest in strategies where those outcomes won't accrue they'll accrue over a much longer time horizon, maybe 5 years from now, maybe 10 years from now, maybe 20 years from now. And it's really about bad things not happening is the way that we've defined, that you can look at prevention. That's a challenge to this space. And so we want to understand how to generate belief or will to really see value in that longer-term time horizon. We want to overcome, I've kind of referred to this, that present bias and the trade-offs that we think people are making between the present and future. That isn't a bright line, but we want to be able to address that and come at that. And this is the understanding how people think about problems, is having a sense of urgency, and again, connected to that longer-term outcome time horizon. Finally, how do we address inequity or vulnerability in decision-making for investments? And again, this is sort of how do we think about making investments now that will accrue outcomes into the future? How do we do that in ways that we think are going to really promote equity and looking hard at equity as a driver of those decisions that we make? Questions should really ground your proposal. Those are the questions around defining and measuring value and how do we sustain investments in prevention. It will give you a sense of the kinds of approaches or where we want you to be applying those questions. It's the what of the work. And I want to draw folks' attention here to the right-hand column, because this is where we think the field needs to be headed. And again, it's sort of how do we invest in strategies that reflect the complexity of individuals, families, and communities' needs or experiences? And how do we hold that together in the ways that we're supporting prevention and addressing the root causes? We want communities to be engaged in defining what that looks like. So that's an important part of where we think this space needs to go. We also want people to look at addressing the root causes and the systemic changes. So we really want to focus on prevention strategies that get at systemic change. We're not wanting proposals that just focus on a single intervention, a behavior change intervention. We really want to get at those root causes and really look at prevention strategies that address systems change. Finally, we want to look at strategies that reward investment in long-term solutions. Over to Jennifer now, who's going to go in depth on the potential activities and some of the factors for the proposal evaluation.
Thanks, Rachel. I just want to remind everyone on the line, too, that if you have any questions that are coming up for you as we go through this presentation, to please submit them to us in the chat box, and we will get to questions at the end. On this, you'll see a list of potential activities that your proposed projects can take on. Just one that these are just examples of types of potential activities. We really are open to a range of approaches that you might want to propose. We are asking that proposals address all of these activities. The guidance we give is that you'll just want to make sure that your proposed activity aligns with the question that you are proposing. We want projects that focus on demonstrating the value of only a single intervention will not be considered for funding. So the factors that we will be considering as we review and assess the proposals. Importantly, as Rachel emphasized, we're really looking for proposals that clearly articulate a critical question or challenge related to the value of prevention and your strategy for addressing that. Proposals that focus also on strategies that promote strong families, healthy relationships, and community well-being. So strategies that intervene on risk factors or address the root causes of poor health and family violence. Your proposals focus on vulnerable communities and lead to improved outcomes in their health, well-being, safety, and equity. And finally, we'll be looking for proposals that build upon best practices of today, while also contributing to new thinking that can help shape future directions, engage a range of perspectives, and interdisciplinary thinking and partnerships. We need to submit an application. The instructions are detailed out on the request for proposals document that we circulated. The average grant size can range from $50,000 to $250,000, and the term can range from 12 to 24 months. And for we are open to partnering with all types of organizations. Mainly, we'll be looking at how you address the key questions that we've outlined. So we encourage you to refer to the specific issues and questions that are outlined, again, in our fee document and in this webinar presentation, and deciding whether or not to apply. And previous grantees of the foundation are eligible to apply. The timeline, proposals are due to us by Thursday, June 28th, and those selected for grant awards will be notified in September, and the grants will start in October. Thank you so much, everyone. I see some questions have already come in, so we're going to move to the question and answer portion, and feel free again to keep submitting any questions you have in the chat box. So, we mentioned that projects that focus only on the value of a single intervention will not be considered funding. The question is, what is your definition of a single intervention?
I think what we're really looking at here is, in prevention, we've seen a lot of just narrow kind of behavior change strategies. So we're not interested, for example, in supporting like a disease prevention program that just focuses on building knowledge, skills, and education to create an outcome. And you could play that out with different kinds of diseases or health challenges. So this isn't just a knowledge, skills, and awareness and education building exercise. We're looking for approaches that really, again, reflect the complexity of individual family and community experiences as they exist and get at the root causes. So a lot of times just a single intervention in a particular organization or setting doesn't really acknowledge or try to meaningfully address the root causes. That is not something that we're looking for. So we're looking at the strategies themselves to kind of reflect the complexity of human experience and the complexity of the root causes, what's really driving poor health and violence.
Great. Thank you. Would you be open to funding a new partnership?
We think creating systems change is all about collaboration and partnership. It's at the core of our Collaborating for Healthy Communities work. We know that in our Breaking the Cycle of Domestic Violence work that new partnerships and collaborations are needed. So I think I would encourage folks to think about it as you approach both the issues that you're trying to address and your questions of value, to think about where partnerships could be useful and strategic.
What kinds of collaborations that we've funded in the past?
I mentioned our Accountable Community for Health initiative, and the California Accountable Community for Health initiative, I encourage you all to check that out. That's been a really powerful example of using kind of a system change strategy to address an important condition or set of conditions in a community. And what's interesting about that particular initiative is that it seeks to, and this gets at the complexity of the intervention strategy, on clinical strategies, clinical to community linkages, policy change and environment and system change, and really to do all of that across a defined population. And so we have 50 communities across California that are experimenting and implementing with the Accountable Community for Health model. That's one example I would offer. I think there's some really exciting work going on, too, that's looking at kind of what the complex set of services or prevention strategies could be around a particular lifespan. So we've seen a lot in the area of early childhood. People are defining sort of 0 to 3, 0 to 5 as a critical period, and recognizing that a bunch of certain supports need to be in place for families to set them off on a trajectory of health and well-being and safety. And so that's another example of, you can define collaboration in different ways and slice it in different ways. We've also seen other kind of bundled sector strategies. I mentioned multi-sector partnerships, so that may be another way of defining collaboration, is bringing together multiple sectors. We're very open to how it could be defined, and I think there's different ways to think. There could be a strategy around family-centered approaches that really better connect children, parents, and families. So there's different ways to think about collaboration, and we want to encourage innovation and creativity in that space.
Thank you. Is there a desired size of impact? For instance, would you consider a proposal that impacts these questions within a very specific community?
The answer is yes. But I would say the smaller the population, the higher bar that we would have for kind of complexity of what you're going to do. So what we want is a really small population and a very limited strategy that you're looking at for exploring this question of value. If the population gets smaller, the bar kind of gets higher for both. Is this truly innovative, truly cutting edge, and does it, again, kind of mirror the complexity? And we'd also, if the population is really small, we really want to see kind of what the potential was for learning for the field. And we're a large statewide funder, and so it's hard for us to go very narrow and very deep in a small place without thinking about the implications for the broader field. So those are some of the tests, I think, for as the population, if the population gets smaller, the scope gets smaller, we'll be looking at sort of how innovative is the approach, how clear is the question that you're trying to answer, and what's the potential for impact, and does it kind of reflect the complexity we're talking about?
Great. Next, do proposals need to address the issue of sustainable funding directly? So that is, does it include outcomes around funding streams or sustainability? Or can the work be more around messaging and measuring value that could later to new funding and fundraising strategies?
Either or both. This is where, in this particular request for proposals, we want to create a lot of flexibility, which is why we offer the different questions that you could try to answer. So you might just try to answer one of those questions, which could be around how do we build will, how do we define value. It could be things like aging residents and thinking about, how would they answer that question. So you could go really creative on the messaging side and really understanding framing challenges. That gets to that present bias question that we asked. Or you could go in the other direction and really this concrete, where is the money flowing? Where is it coming from? Can we bundle it differently and in new ways? So either of those strategies are acceptable. You don't have to do both. If you want to marry them both, you could in a proposal. It just depends on kind of how you're approaching this challenge. But yeah, you can do, it can be an or and an and.
So one potential activities we listed was policy research and development. Is advocating for policy and systems change an allowable activity to propose, recognizing that it would not go into lobbying?
No question. I think what we would have to understand about the advocacy strategy is how it tied to the questions around value. A question around value are you trying to answer through the strategy? And how likely is it that advocacy strategy would result in sort of concrete action on the value question. I get that's a great answer, but it's the one I've got right now. I'll think about that question more and putting some more kind of parameters around advocacy. We do have another initiative will focus on advocacy, and so let me just also foreshadow, likely to put out a funding opportunity or make some investments in the third or fourth quarter of this year that are related to advocacy specifically. So another opportunity is coming down the line for that, and our inboxes are open on having conversations about different advocacy strategies that could answer this question. So again, centering the puzzle around the value inquiry, those questions that we have on that slide, and what's the intervention that you're kind of, or the strategy that you're applying those questions to are those should be the center of the proposal. If advocacy is articulated as an activity that will get you to those two spaces, then I think it would be something we could consider.
A few questions about what are the final products that we are looking for as a result of this grant. So use an example of supporting young children through a family and community approach. So what final product would you be expecting at the end? A white paper, actual intervention, something else? What are the final desired products as a result of this grant?
Slide that listed the potential activities. I don't have specific guidance on the products. Again, it just is the flexibility that we're trying to allow for in this proposal. So the proposals have to center around answering a question or a set of questions, either the ones we've laid out or the ones that you're going to propose. The products are going to the right product will emanate from how you're going to approach that question. And that's for you to tell us. I don't think we want to really bound or put parameters around the products. Based on how you're, again, what question you're asking and how you're approaching it.
Looking to fund new initiatives or the deepening of existing work qualify?
I want to answer without a little bit more detail, but I think the work that we're looking to fund has to focus on prevention and addressing the root causes. If that fits with deepening your existing work, whatever your existing work is, it would be eligible for funding. It didn't necessarily have to be a new approach. Again, in the questions around value, we are looking to be on the cutting edge of where we think the value challenges lie. And again, that for us involves is addressing the root causes, getting at the complexity of individuals, families, and communities. And that to us is what would need to feel new. It may not be new for your organization, but that's what we'll be looking at as we ask the question about building on existing work or funding new work.
Thank you. Can you speak a little bit more to what you mean by prevention? So a few specific examples. Would working with DV survivors and preventing recurring DV count as prevention under this RP? Would students looking to address root causes in their communities and addressing DV in their communities count as prevention work?
Opportunity to refer folks back to our strategy webinar because there's some really nice visuals in the presentation on breaking the cycle of violence that will give you a sense of where some of the prevention points are for domestic violence. We would be open to considering proposals that look to prevent the recurrence of DV, but have a bar for those proposals, which is that will need to look different than it looks right now. So that's space where we'd be looking for new approaches or new strategies. We know that Right now, a lot of the recurrence, the strategies for preventing recurrence of DV, many of them are grounded in the criminal justice system, not in a public health model. So that would be a bar for us if you're going to look at prevention from a recurrence standpoint. We're going to need to see some approaches and interventions that are different from kind of how those systems and services are set up now. We've been doing some, we've funded a consultant to support us in looking at a life course framework for understanding domestic violence and how to prevent it and break the cycle. And that, again, is in the strategy webinar, but I'll give sort of hints of what's in there. One, what we're seeing is that the biggest risk factor for domestic violence victimization or perpetration is actually witnessing interparental violence as a child or being a victim of child abuse and neglect. So one of the things I would encourage you to do on the domestic violence side is understand what some of those big risk factors are, and think about how are we going to intervene on those risk factors in ways that will help us disrupt that trajectory and break the cycle of violence.
Does he seek to support DV and health prevention service delivery in its entirety, or does the RFP seek to only fund the portion of a project that seeks to demonstrate the value of existing prevention strategies?
This particular opportunity isn't about funding service delivery. It's got to focus on this question of questions around value. So it won't be enough to say my organization or two organizations want to partner together to develop a new way of delivering services. That is not going to qualify. That alone will not qualify under this request for proposals. Doing something that already works and you think is leading to prevent an early intervention of domestic violence or producing health, so getting ahead of these problems before they reach an acute stage, and you think there's an important question you need to answer around the value of that partnership or that service delivery model, that's what would qualify. Again, we're not just funding innovations in service delivery here. We have to, this proposal opportunity is all about asking the question of value and demonstrating value.
Questions come in about the reach that we're trying to look at to achieve across geography and population. So for the geography question, wondering if proposed activities need to happen in California. And population, the specific question is, possible to focus on a complex segment of a larger population in respect to prevention, such as focusing only on young women, young men.
They're all parts of that question here. So the first answer is it doesn't have to take place in California, but it has to be relevant and applicable to California, and ideally it would be something that isn't being done in California already. So it would be something that would provide new insights and information that has relevance and applicability in California. So that would be kind of the bar we're holding on out-of-state activities. But we certainly know how important it is if there's innovation going on in other parts of the country when it comes to value, and there's an opportunity for us to grab onto that and learn from it for California and for the California context. That's something that we'll consider. We definitely are open to focusing on a segment of the larger population. We're talking more at the foundation about, I think it's called selective prevention strategies. And we think that's really important from an equity perspective. So we need to identify the populations that are at greatest risk or greatest promise and really think about how we're going to structure supports and strategies around them. So I think a focus on a complex segment of a larger population is a competitive strategy for sure, and one that we think is important from an equity perspective too.
Question is it accurate to say that delivery of service is really secondary to producing demonstrated value for the intervention? For this RP?
One where it has to be, they're not, it's not primary or secondary, because I think they often go together. Imagine, unless you're getting at the questions of the questions around building will that are in that around the longer time horizon for investments or addressing belief, that would be a space where you don't need to have sort of service delivery and value queries together, although I'm not even sure that's the case actually as I'm saying this. So I wouldn't look at it as primary or secondary. They often go together, but again, what I'll re-emphasize is we're not just funding innovations in service delivery without asking the question about value.
Great.
You can't have one, you might be able to have a value inquiry without a service delivery inquiry, but you have a service delivery strategy without a value question.
Question is, does domestic violence prevention have to be one of the objectives of the proposed program, or is general community health improvement or crime prevention sufficient?
The latter, so you can focus on community health improvement and crime prevention, violence prevention as it relates to crime. That gets back to that initial question, the way that we framed it. So we said at the beginning, this is an and or, so it doesn't have to be, it can be one or the other or both together. So the proposal does not have to focus on domestic violence. It can, but it doesn't have to.
When you use the word value, can that be synonymous with impact?
Yeah, I mean, I think questions of value are very much tied to questions of impact. Those two concepts go together, and I think, you know, impact we can think about different ways. I mean, there is this sort of is trying to raise around belief and will. Sometimes all the great data in the world doesn't change people's minds. So we need to understand how people think about these strategies and what their beliefs are around them. Beliefs are in acting now to prevent bad things from happening in the future. So that's really important. It's an important piece of the puzzle. So I think you know, both kind of understanding how people think about these issues and also understanding impact and the real kind of data and the real effect that we're having on people's lives with the approaches that we're supporting.
So we have questions now about the types of organizations that are eligible to apply. So first, can for-profits apply, and if so, do they have to partner with a nonprofit organization?
For-profits are eligible for funding, and they do not have to partner with a nonprofit organization.
Can service-oriented organizations apply? Can organizations such as batterers intervention or reentry programs or other direct service organizations?
Yeah, there are any limits to the types of organizations that can apply. The parameters that I would say to focus on are backed at the value questions and the what of the work. Those two slides that we had about the kinds of strategies that we're looking to fund, those desired approaches, and the value questions that we've asked. So that's where, again, that the proposal really centers around that. The type of organization doesn't matter. It's the type of work that we'll look at.
multiple partnerships or collaborations and want to submit a proposal, what guidance can you give?
I guess that maybe it's helpful to understand if this is a technical question about an applicant. I mean, what we've done is we've funded a single organization, but we have allowed for, when that proposal comes from a single organization, then we would encourage, if there's a collaboration, to do resource sharing among the partners that are engaged in the project. So that's typically the way that we've funded collaborations. We could think about alternative approaches to funding collaboration. In a collaborative proposal, we're always going to look at the strengths of the collaboration. So, and kind of how do the strengths of the different partners align? Are they all on board with the strategy? Are they all contributing something to the strategy? So we ask a number of general kind of questions about collaborations when we get proposals around them. So most of them, are they sharing resources? Are they kind of aligning different kinds of expertise and in they're proposing to do?
Can a nation apply for a grant and already be a subcontractor of a different grant from the foundation?
Yeah, no limits here. Again, in terms of organizations, you can be getting a current grant from the foundation. You could be a subcontractor on a current grant. That does not exclude you from applying for the RFP.
And are applicants expected to solicit sources of those who are on the line, please mute. Thank you. Question is, are applicants expected to solicit other sources of support or commit their own resources to match Blue Shield of California Foundation support?
Any requirement around matching support or co-funding? Obviously, it's great when folks are bringing existing resources to bear or bringing together funding partners who have a shared interest in a particular project. It's always great to see, but it's not a requirement of the grant.
Projects need to demonstrate changes that are impacts such as reduced domestic violence within 12 to 14 months of the grant.
Part of what we're looking at in this particular RFP is that I know that a lot of prevention strategies have a longer-term time horizon for outcomes, and so we're not holding these proposals to demonstrating a change on a health outcome or a DV outcome in 12 to 24 months. But what I want to encourage folks to is look at literature. It's been, something that we've been doing here at the foundation as we launched this new plan is really trying to understand what do we know works in prevention, what strategies that we think are needed but don't have the evidence base behind them yet. That's a really important inquiry for us. So no, don't have to produce health outcomes or changes in domestic violence outcomes in the 12 to 24 months time horizon.
Comment is that it seems that there are two key questions here. The first one is, how can prevention projects provide evidence of impact on clients? And how can organizations leverage that evidence of impact into sustainable funding? Does that quotation sound accurate? Is there a preference for either type of question in the review process?
Really good questions. I mean, those are the questions that we're asking ourselves. And I think I'll add to this is, and it kind of relates to the last question about the time horizon for outcomes. This particular grant might get you started on a longer-term inquiry. I don't use the term planning grant, but that's certainly something that we're considering. So we would look at, again, it depends on the question, it depends on the strategy that you're looking at, but we're considering proposals in all stages of what I would call a life cycle. So it could be planning, it could be actually testing. It could be more evaluation, looking back and evaluating, using data to evaluate what's worked and how that then ties to this question of value. So we're open to considering proposals at all kind of life stages, I guess, of the project. And some of that will really depend, that I think will be an important question for applicants to ask themselves is, these are pretty big questions. So where do we start, depending on the question that we're asking, where are we plugging in, at what stage?
When you're demonstrating value, can you speak to who you're demonstrating value to? Would that include funders, the corporate organizations that control public funding, other sources?
All the above. I mean, one of the things we're curious about is we broaden the base of investors. And so how I would come at that question as creatively and expansively as you can. I mean, I think for the nonprofit sector, we've always kind of had a typical, even foundations are part of this, right? So it's like do something, show it works, and then prove it to government so government will pay for it. And we know that sometimes that works and sometimes it doesn't. Seeing, some creative investors from the core space. We're seeing like ground investors from the community. Maybe there's some really interesting ways of invest community-driven resources and crowdsourcing resources in these challenges. So we want to think expansively about who an investor is in prevention, and it could be the communities and families themselves, government, corporations, foundations. The question, and I'm sheepish saying this because we are a foundation, but probably everyone on the phone knows this, foundations aren't the best source of sustainable funding. So I would just add that as a cautionary tale that when we talk about sustainable funding, we need to not think as much about foundations, actually.
Open to funding proposals that have multiple components with an organization that might target two different subpopulations, such as two different age groups, still addresses the overall questions of the RFP.
Yes.
Great. This is about how many projects will be funded and the total amount and the average grant amount. So the average grant amount, can answer that, we range around $50,000 to $250,000.
I think any time grant amounts are tricky, we always put a range down, actually, because we need to have that as the limiting factor, or to feel like people have to, go to one, focus in on a dollar amount. So what we always encourage people to do is really think about, the scope of the project, and what resources are needed to accomplish that scope. And sometimes a $50,000 project can have a huge impact. So it's not the size of the dollar that necessarily matters, but it's what resources do you need to really execute on the scope and on the question that you're trying to answer.
The grant start date is October 2018. Can projects begin later than that?
So the constraint on our end is that we need to make the grants in this calendar year, because this is the budget that we have for this calendar year. I think for this question, I think reaching out to us on a one-to-one basis is probably the best way for us to solve it. For the most part, we want to get the work going this year.
Great. Thank you, everyone, for all the great questions, and thank you, Rachel, for answering. Just a few key quick follow-ups. The best way to get in touch with us if you have additional questions is by email, and you'll see on the screen the two contact information. For content questions, you can email Rachel Wick. Her email is here. For technical assistance in submitting applications in our grant system and you can email our grant email address. The RFP document that we have been referencing is available on our website under the blog, so you can go there to review the RFP document. To follow up to this presentation, we will be sharing this PowerPoint presentation, this entire webinar recording, and a document of FAQs. We encourage you to check out our website for more information about our initiative and our work, and also to sign up for our email newsletter to keep up to date on what we're doing and learning and future opportunities for funding. So again, thank you so everyone for engaging with us, for your questions, and please feel free again to reach out to us if you have any specific follow-up. And we look forward to receiving your applications.